A 16-year-old boy presents with progressive hip pain that worsens at night and intermittent fevers. I am showing you an AP femur radiograph, a post-contrast fat-saturated coronal magnetic resonance, and an axial computed tomography of the proximal femur. Please describe the findings.
The radiograph and computed tomography show a well-defined lytic intramedullary lesion in the subtrochanteric femur with endostele cortical erosion. The post-contrast magnetic resonance demonstrates intense enhancement of the lesion, along with extensive reactive enhancement of the adjacent marrow and surrounding soft tissues.
What is your primary diagnostic concern?
The findings of a solitary lytic bone lesion with extensive surrounding marrow and soft tissue edema and enhancement in an adolescent are highly suggestive of eosinophilic granuloma, the localized skeletal form of Langerhans cell histiocytosis.
What are the three classic clinical entities historically associated with Langerhans cell histiocytosis, and which is the mildest?
The three entities are eosinophilic granuloma, Hand-Schuler-Christian disease, and Lederer-Sill disease. Eosinophilic granuloma is the mildest and most common form, typically presenting as solitary or multiple bone-limited lesions.
What are the pathognomonic electron microscopic findings and diagnostic markers of the cells of origin in this disease?
Electron microscopy classically reveals tennis racket-shaped cytoplasmic inclusion bodies called Birbeck granules. The cells of origin also stain positive for S100 and CD1A surface antigens.
What are the classic radiographic features of this condition when it involves the skull and the mandible?
In the skull, LCH shows lytic lesions with beveled edges due to unequal destruction of the inner and outer tables, occasionally containing a button sequestrum. In the mandible, severe alveolar bone resorption creates a floating teeth appearance.
What classic spinal deformity is associated with vertebral involvement in pediatric Langerhans cell histiocytosis?
Skeletal LCH in the spine classically causes symmetric collapse of the vertebral body, a deformity known as vertebra plana or silver dollar vertebra.
Why is the extensive surrounding bone marrow edema and soft tissue enhancement on magnetic resonance imaging highly clinically significant?
This edema and enhancement can simulate aggressive malignant bone tumors like Ewing sarcoma or osteosarcoma, as well as acute osteomyelitis. A biopsy is mandatory to confirm the diagnosis and rule out these aggressive mimics.
Finally, what are your clinical management recommendations for a solitary eosinophilic granuloma?
I recommend image-guided core biopsy to confirm the diagnosis. Once confirmed, treatment options for a solitary asymptomatic or painful lesion include observation, local corticosteroid injection, curettage, or low-dose radiation.